Good evening. My name is Carmilla Tan, and my topic is Stop Offering Health Benefits That People Don't Need. Okay, so when I typically introduce myself, I mentioned that I'm a healthcare actuary that cares about ID cards. In health benefits, ID cards are very tangible. Employees expect them to be accurate and timely. It's not just about the numbers, it's also about the member experience. In my past job, I ran employee benefits, health insurance and strategy for companies as big as 300,000. And I talked to the senior leaders, and I'd also talk to some very angry employees. That was part of the job. These angry employees wanted to know, why was their provider not in the network? Who chose this network? I want a relationship with my doctor. What was the criteria used to pick these doctors that are in my health benefit plan? I would typically counter with, oh my God, look at how big this network is. There are brand names like the Mayo Clinic, Cleveland Clinic, Johns Hopkins, 1 million providers nationwide. Ooh, sorry, I'm a health actuary. I like numbers. 1 million providers. Surely you could pick someone from this list. What would typically happen though, is that you would still have these angry employees basically saying, did HR choose this for me? Did a benefits person choose this for me? What is the criteria? And the problem with the number of 1 million providers nationwide is that people consume healthcare locally. Who cares about providers in Texas or the West Coast when you were in New York, the center of the universe? So people like to choose. They do not want the choice of their doctors and hospitals left to the benefits person, which would have been me back then. So what does this mean? Two things to think about. Think about healthcare being local. Think about healthcare being smaller. Think of these health plans being micro. Hopefully everyone's from New York and is aware, this is a map of the Metro New York area. And so these bubbles are basically micro networks. So these micro networks, people consume healthcare locally, offer them smaller, comprehensive micro networks through brand name health systems. Additionally, give them choice. Give them real choice. Don't be the person, the health benefits person choosing for them. Give them many choices, small micro networks. People consume healthcare locally. I'm a healthcare actuary. Of course, there are numbers. Aside from the 1 million, there are studies that show that the travel time for routine healthcare is 18 minutes, 9 miles. So again, offering 1 million providers throughout the US is interesting, but that's not real choice. We need to give employees choices that fit where they live, where they work out, where their childcare is. Give them choices that fit. And again, if you're going to say, I'm going to give you micro networks, they're comprehensive, brand name local hospitals and providers, you need to give them tools. So don't forget about making sure they understand what they bought. Otherwise, they're going to come back to you and say, I didn't understand when you meant micro network. I couldn't go to the West Coast and use that. So that's very important. So think local, right? We do certain things in a local fashion. And also think about offering choice. Many of these micro networks, employees choose. These will make your employees happier because there really is no such thing as 100% happy employees. And fortunately, if they're happier, they can focus on other things like the 401k, right? Get them out of your hair. Why is this important? This is really important because when you think about top talent, healthcare is the #1 benefits people care about. There are many surveys that say you can offer them many different perks, but #1 on their list is healthcare, health benefits for themselves and their family members. And so when we think about differentiating ourselves from other competitors who are also looking at the top talent, we need to innovate the health benefits that we offer. Again, throughout the past couple of years, no real new thinking on healthcare and what's being offered. It's more about cost share, what the company subsidizes, co-pays. Think about offering new benefits. You need to differentiate yourself from your competitor. So offering 1 million providers versus your competitor to a top talent is just not a differentiator. So stand apart from the competition. I urge you 2 things to think about. Think smaller, micro, brand name hospital systems, and offer many of them. right? Because a narrow network is just basically a big network smaller. My name's Carmilla Tan, and I am a healthcare actuary that cares about ID cards. Nice to meet you. Thank you.